Can you see my screen?
Yes. Hello, everyone.
Sure.
Hope I'm audible. My name is Surya. If I'm audible, can you please type in yes in the chat box, please? I hope everyone can hear me. Great. Hello, everyone. So we're just waiting for a couple of more people to join in. Let us wait for like 3 to 4 minutes, then we can start. Great. Thank you, everyone. Thank you for joining today. I hope all of you are doing well. So we're starting with the webinar. I'm joined by my colleagues Jyotsna and Pawan. So Jyotsna is a senior consultant with Sattva. She's been working with Sattva since the past 3 years, and Pawan is a senior engagement manager who works majorly on the CSR advisory team, and he's been around for more than 5 years now. So thank you all again for joining. So before we move on, can you go to the next slide, Divya? Great. So this is the agenda for today. We're going to first cover the Sattva's COVID response. The first 5 minutes, we will talk about what we have done and what we are planning to do. The next 45 minutes, we'll be talking about the needs assessment, the importance of needs assessment, the frameworks, the approach which we generally follow, and some sort of like discussion around it. Then the 10 minutes would be, the next 10 minutes would be on how do we use these needs analysis, needs assessment findings to make decisions, and also in program designing part. The last half an hour we'll be dedicating for Q&A. So, you can ask your questions in the chat window, and we'll be able to answer all of them in the last half an hour. Next slide, Divya. Request to all of you, please keep your webcam as well as audio on mute. Please switch off your webcam so that there is no interruption in between while we are presenting. As we mentioned earlier, we are going to address all the questions. We'll have a dedicated Q&A session in the last half an hour. So that's between 4 to 4:30. We'll be talking about all the discussing all the questions you might have. Great. So as I mentioned, to give you a brief idea about what we have been doing and what we plan to do as a part of our COVID relief work, we're working in 4 tracks. One is engage, where we are trying to engage with the different ecosystem players and enable their decision making through data. So we have a dedicated portal called India Data Insights, where we are collecting live data on how the COVID how COVID is spreading across different regions, and sharing that data with PSUs, governments, CSRs, NGOs, etc., so that they can use that data, the visualization of the data, to take decisions on where they want to actually provide relief work. We're also orchestrating the immediate relief work, which is we have supported many corporates. We have connected corporates and NGOs in helping provide PPE kits, other medical supplies which were required, and so that has been going on. And I'm sure now we are moving towards a much more long-term approach, which is build. So we have a separate build track in which we are looking at what kind of intervention models we can design, which will basically focus on medium-term and long-term impact. So we are working again with NGOs as well as funders to identify the common interests and build those intervention models which can be implemented with support of the funders and the NGOs on the ground. And finally, we are also enabling social enterprises to survive and thrive to achieve greater impact and scale. So these are the main 4 tracks. Pawan, Jyotsna, you want to add anything on this slide? I mean, whatever I've missed, please chime in.
No, I think Surya, you have covered it all. Yeah.
Okay. So before we move to the next slide, we have a poll question. It'd be great if you could take like a minute to answer it. Question is, what is the purpose of a needs assessment? What, according to you, do you think is the purpose of the needs assessment? Great. So 77% of the respondents mentioned that it's to enable program design. Well, 60% of them mentioned that it's understanding community awareness and knowledge around focus areas. That's interesting. Yeah, and a few of you also have mentioned that it's to establish recorded needs and understand the size and expertise of the team needed for the program, understand its specific solution. Great. So yeah, I think it's all of you are like align on, or we can say that most of you think it's for program designing part, but there are also other things which we will be able to get out of doing a needs assessment study. That's good to know, right? So through this webinar, we're going to cover a few questions. Divya, can you move to the next slide, please? One second, guys. I think this, yeah, great. So these are the broad questions we want to answer through this webinar. We want to answer what is a needs assessment? Why is needs assessment important before we design a social development program? Most of you have mentioned that it is already important, and I think we're already aligned on that, but we can go a little deeper into why it is required. How is it actually different from a baseline assessment? Because in conversations with different stakeholders, we come across that there's some misalignment or some misunderstanding about it. So we take this opportunity to try and share our point of view, and we'll also be able to answer the questions at the end on that part. The fourth point we want to talk about is when should a needs assessment be done, and who would actually benefit out of it. When we say by whom, who would be either doing it on their own, or who would be actually commissioning someone to do that. Could be anyone, but who would be the major beneficiary out of it? Who should be commissioning the study? What are the different steps which are involved in doing a needs assessment study? Then how are we going to interpret the results? Like once we do the study, we get the results. How are we going to interpret it, and how are we going to make decisions based on the findings? These are the major points we want to cover in today's webinar. So can we move to the next slide, Divya? So to quickly define what is the needs assessment, most of you already know about it, but just to put it out there, it's a systemic process for determining and addressing the needs or the gaps between the existing conditions or whatever the community is currently, the challenges which the community is currently facing, and what is the desired conditions which are, which are supposed to be in a community or a geography or a context. So the gap or the needs of that community to achieve that desired condition is basically known through a needs assessment study. So the discrepancies between the, as I mentioned, the current conditions and the desired conditions can be measured appropriately by identifying those specific needs. And a good metric we can use, or we can leverage upon to identify what are the desired conditions, are the SDGs, the Sustainable Development Goals, which all the nations in this world have agreed to achieve it by 2030. So that can be a good goal post for us to plan and achieve those goals. So we can compare what are the existing conditions in the communities now, and how can we achieve those SDGs by 2030. This needs assessment study will help us do that. So for example, I think before two Sustainable Development Goals, we had MDGs, which is the Millennium Development Goals. So in 2004, the United Nations Development Group, they have completed a series of need assessment studies where they have conducted it in multiple countries like Bangladesh, Cambodia, Ghana, Tanzania, and Uganda. And they've identified that in Bangladesh specifically, there 50% of the population is living below the below poverty line in 2000. So that shows that there was a gap of like 20% already existing, and that was the need which had to be addressed. This particular study has helped identify how they can be addressed. So they went into in depth, and they could define how actually can these needs, or how can they actually achieve that goal of allowing those 20% people come out of poverty. Great. So can we move to the next slide?
So before we move to the next slide, Surya, let's understand from the audience, what could be a needs assessment report. So I'll quickly launch a poll.
Sure. Yep. Please, yeah. Okay, that's interesting. So I think 67% of them have mentioned localized SDG priorities and targets. 10% of them mentioned a CSR policy document. Government policy document is 35%, and 27% is Gram Panchayat village committee plans. So I think more or less we can say that the localized SDG priorities and targets will help us identify what do we want to achieve. And the government policy health documents as well as Gram Panchayat will give us the existing macro level understanding of the existing conditions. So I think it's a mix. It just cannot be one document. But yeah, this question was more to understand what your thoughts are. So this is helpful. So yeah, coming to the next slide, which is why is a needs assessment important for designing a social impact program? When, as you already know, it's basically to first target the most vulnerable people. It will help us identify who are those group of people. Like it could be ultra poor women, it could be school children who are supposed to be in schools but they're not being able to go to schools for various reasons. So we will be able to identify exactly which is the group which needs the support. It will help us target them well. It will also help increase the collaboration between the different stakeholders existing in the community. When we say increase the collaboration, when we do a needs assessment study, the important stakeholders are the community members, and from them, when we learn about what their needs are, uh, they are on board. Like they're already sharing what do they need. So it helps bridge the gap or the distance between the decision makers and the community. So it will also lead to more community participation in when a program is being implemented, so that they actively take an active part and also sustain it even after the program ends. Within the organization, or like an implementing partner is going to implement a program, it will help it'll help make systematic decisions in when they're making a program, because they already know what kind of gaps exist in the community. They can prioritize which ones to address and how, and that will help them come up with a more structured approach to create a larger impact. As I said, moving to the next point, it will maximize the impact. It will help create replicable models which can be scaled into different geographical contexts if the same needs exist. You don't have to do a needs assessment every place. If we are able to identify that common gaps exist in a few regions, so if we do a needs assessment in one location, we design a program for that. We just have to verify that in another location, whenever we are going to scale it up, can the issues be generalized? And then if the issues are generalizable, then we can scale up the same program there. So one way the needs assessment study will help is be able to achieve that scale as well. The last one, the most important one, is it avoids duplication. Currently, we know that there are many NGOs, many partners who are working very hard to achieve, maybe universal healthcare, universal education, various goals which we want to achieve, especially SDG goals. But the needs assessment study, through which we'll identify the overall ecosystem, like what are the different schemes or programs or already NGOs which are working there. If when we take those into consideration, we already know that there is some program or some intervention already happening in that area. So it'll help us collaborate with them, or it'll help us identify what they are not doing so that we can take it up. In that way, we will avoid duplication, and it will create a ecosystem where we can work together and achieve that larger impact. Okay, moving to the next question, next slide, we have another question again. If you can answer that.
Surya, can you see the screen?
Sorry, I'm sorry. Can you hear me now?
Yeah.
Okay. Sorry, I was by mistake, I was muted. So I was just saying that I think most of you are already aware about what is the difference between the needs assessment and a baseline. Almost 81% of you have answered that it's supposed to be conducted before the start of the program, and 52% of mentioned that a baseline is conducted at the start of the program. So we'll try and answer this question through the next slide more in depth. So as needs assessment, it basically identifies the needs and informs whether and how to intervene. So it'll, as you already are aware, it helps to design the projects which we want to do on the ground. And a baseline study is done basically once you already have a program designed and you want to roll it out, just to understand where the community is now. You do a baseline study so that you can compare it with the endline study after the program has implemented. So that gives you the change which has happened during the implementation of the program. So that's the major difference between a needs assessment and a baseline. However, a needs assessment study can be, provide us with some data on where the community is currently. So it can be used as a baseline study as well at some points of time when we already know which are the areas we want to focus, or we can use some indicators or some data which is already available from needs assessment study as a baseline. Like, it'll help us understand what the existing situation in the community is in those specific indicators. Okay, so before we move, I think we have another question. Great. So 49% of them mentioned that it's supposed to be done by implementation team. Well, in our opinion, it's all of the above. It's relevant to even the funding team, the implementation team, the third-party organizations, local community leaders, for everyone. It can be used as a good process to understand what those needs are, without which we cannot design effective programs and without which we cannot create impact on the ground. So we can move to the next slide. So when should we do a needs assessment study? Prior to the intervention, as we've already agreed upon. We can also do it during or after the intervention when you really want to understand the emerging needs. For example, in the recent times due to COVID, although certain programs were being implemented, many NGOs have been thinking about how can we re-strategize given that the situations are changing. So could we do a quick rapid needs assessment study to see what the current needs of the community are, and then make some course corrections so that we'll be able to deliver or provide that support which is actually required in the community right now, not before COVID. So that way a needs assessment study is relevant in these during these difficult times as well. It's also It's basically when we also want to align between the program team. So the program team might have already some understanding of what the issues on the ground are, but a needs assessment study will give that clarity on what are the areas you really want to work on. As mentioned earlier, we spoke about the ecosystem support, where the community members as well as the other social impact partners who are working on the ground. This study will help us identify these different stakeholders who are already doing something or what the needs of the community are, and this will help build that the partnerships or the collaboration between everyone to identify which are those issues which have not been addressed, and then help us design the program that can address those. And also the data-driven approach towards program designing can be brought in by the needs assessment study. So as we discussed, it's by everyone. It's useful for everyone. It's for NGOs, funders, social enterprises, program implementation teams, solution providers, as well as policymakers. All of them can use this particular process to identify those needs and build those models which are effective. I think we have another question after this. Great. So I request Jyotsna to take it from here. Over to you, Jyotsna.
Thank you, Surya. Thank you for taking us through the concept of need assessment and also running us through different stakeholder perspectives of how and why a need assessment should be conducted. So while we are talking about how a need assessment should be done, I think the responses are very clear on what are the parameters to be considered. While we are understanding the community view, whether it is quantitative information, qualitative information, both of those need to be included definitely. And the third one is also understanding the population and statistics from a local administration to get a macro view. Divya, could you move to the next slide, please? Yeah. So in line with the previous poll discussion that we had, how does Sattva approach a need assessment study is something we are going to discuss in the next couple of slides. So the three key components that we go through are, one is benchmarking the development indicators. The second one is, previous slide please, Divya. The second one is understanding the needs of community and their aspirations. The third one is understanding the ecosystem that is available in the community. As part of benchmarking, benchmarking essentially gives a macro perspective of the particular geography or the context of the study to understand more about in each thematic area, whether it is health, agriculture, livelihood, or any other area, what are the respective SDGs that are aiming at a national level, localized level, whether it is at a district level or at a block level, what are the aims of the aims for the target community, and similarly, what are the schemes or the initiatives that are undertaken from a top to down perspective. Then identification of community needs and aspirations is a key component of the need assessment study. Here from the earlier polling point, we had a point that whether it is completely focused on surveying the population for what do they want, or is it about understanding a holistic perspective of what the community needs are from different kinds of sectors, different kinds of population mix, youth, adults, children, all of the areas. So one of the key areas to differentiate is that when we are designing the survey tools or trying to understand the community's needs and aspirations, there is a need to keep it structured, keep the approach structured, so that while we are going for a open approach of what is the need of the target community, the responses don't go too varied and we have a perspective before going into the study. The third part is mapping the ecosystem support. So within the target area that we are looking at, if there is any public or private sector or civil society organizations or NGOs already working, then what is the quality of ecosystem available? Are there any SCGs or JLGs, or are there any PHCs to administer, or ASHA worker kind of local workflows that is already there to administer the program? What is the quality of services available, and what is the willingness of the ecosystem to collaborate on the initiatives for the target community? These are the three perspectives that we go through. Then these three components are amalgamated to identify the priority areas of the target community. We'll go to that we'll go to that from a step-by-step process in the next slides. So this is the framework that is adopted by Sattva for need assessment study. Here, the need assessment study framework follows a kind of logical approach. So while we are saying that a need assessment study is conducted to understand the gap in needs of the community, what is the current status, what is the desired status, and we're also trying to understand what are the causes of this gap. Then we'll try to determine what is a possible solution to address these gaps and the causes of the gaps. So this is the flow that the framework follows. The first three components where we are talking about awareness, accessibility, and affordability, these try to understand what is the current status of the community. So in awareness, the main components that are considered are what are the problem areas in the community? Are the community aware about these problem areas? And what do they think are the causes for these problem areas? That is the first component. The second component is accessibility. When we are looking at accessibility, it is mainly talking about what is the level of access that the community has to essential goods and services. When we say essential goods and services, for instance, a need assessment study is being conducted to understand the water and sanitation, health facilities, and status in a particular target group. Then the essential services and goods will be safe drinking water availability, access to safe drinking water, access to household toilets, or from a health perspective, is there a PHC or any other last mile workforce in the area, like a ASHA worker or an Anganwadi worker, to provide health related facilities? And what is the infrastructure available? Similarly, what is the access to benefits? These are the main aspects covered in access. Then we turn to affordability. Affordability mainly understands the income patterns within the community and also the financial management practices, that is expenditure methods and saving methods, and then also has the component of what is affordability to access the services. This informs the program design component of a study. For instance, when we consider a WASH program and there is a lack of safe drinking water, there could be a possible solution that is considered that 2 rupees per 40-liter can could be provided for the community. In such a case, or it could be any other field, we'll take this example for instance. In such a case, there is a key need to understand, is the community actually able to afford such, component of their income towards accessing these facilities? If they are unable to afford, is that the reason for low access to safe drinking water or low utilization of safe drinking water? So these three components drive the causes for adoption. When we are talking about adoption, we understand the available services and products that are available in the community and try to get into what are the reasons for adoption and what are the causes for lack of adoption. If the causes for lack of adoption will mostly be answered through the awareness component, where the community might not be aware that the quality of drinking water is low, or the access is unavailable, or if it is a cost-based component, affordability is not there. These three are one point of view. Then we also look at accreditation and aspiration of the community. It is also possible that the quality of services that are provided within the local area, whether it is government-based, private sector, or any other sources of goods and services, the quality of it might not be good. For instance, there is access to drinking water 2 kilometers from the area, but the quality of it is very bad. Or there is an access to PHC within 5 kilometers of the village, but there is no stock of medicines, and there is lack of qualified doctor in the village PHC. So these aspects are considered under accreditation. And it was not only strictly limited to government administration and defined practices, but also private sector. For instance, if you can take agriculture, is there an input-output linkage in place? What is the quality of input being provided? Those come into the picture. But the most key component that defines the need assessment study and the most informative component of the need assessment study is the aspiration of the community themselves. So one thing is, from the community, what are the requirements that they have? It's not really a very high aspiration, but the minimal requirements that the community considers they need to have regarding basic services and products, whether it is related to access to education, early child education, and primary school, secondary school, and for health, minimum primary health care center or ASHA or Anganwadi worker. Similarly, what are the minimum requirements that the community perceives that they need? And then the aspiration of the community talks to what are the aims of the community? Where do they see themselves? For instance, let's take an example of an education project. While we are doing a study of an education status in the community, we'll know that there is awareness in the community regarding the availability of schools and the availability of teachers. There is an access to primary and secondary school. But the key problem is enrollment, and the reason for it could be that the secondary school to higher school transition is lower and the dropout rate is very high, because there is no aspiration for continuation of education either from the students or from the parents. They could be diverted towards other livelihood activities or any other activities in their daily life. So these are the key components that the framework covers. Then we can go to the next slide now, Divya. So till now, regarding the execution of the need assessment study, we've gone into two parts. One is the key components, and the second one is a framework of the study. This is actually how we generally conduct a need assessment study. As part of the design, the first component is to align the scope. For instance, like we were talking about, the commissioning party could be either a funder, research organization, a foundation, or implementation partner themselves. Irrespective of that, first there is a need for alignment of in which area are we going to do the need assessment study. Are we going to do a general community-based need assessment study where we'll talk about all the relevant thematic areas, that is health, education, water and sanitation, livelihoods, economic development, all the related areas? Or are we specifically going for a single thematic focus? For instance, there could be a chance that an organization has a set of product or service that is already available for delivering quality education for children. In such a case, they are looking for the best fitment to say, I have such so and so product and I want to deliver it to the most vulnerable of the community, and they want to identify what is the most vulnerable village or district within these 5 districts, so that I can concentrate all my efforts in that specific area. So at this stage, it is important to understand the scope of the study and the priorities of all the stakeholders, whether it is the funding party, or if there are other partners that are providing technical services. What are they trying to know? What are they trying to understand from the need assessment? All of these form a key component in the design stage. The second part we are talking about is identification of measurable indicators. We have talked a little bit about indicators in the benchmarking part initially, but we'll go into a little bit of detail here. So if you're considering, for instance, an organization is looking to understand the education status in a particular village, then we need to look at indicators that reflect on education status, whether there is access to education, primary, secondary, and higher schools. And the second component is what is the quality of education that is there. And in order to reflect on those, we pick on specific indicators, specific measurable indicators that are also adopted by localized SDGs or any other measurable matrices that are usually used in the social sector ecosystem. These are driven by the SDGs that are defined at a global level and then nationalized and localized. Then when we talk about the sampling, based on the geography and thematic area and the scope of the study that we are looking at, the sampling is done to give statistical representation of the views of the community in case we are including a quantitative study. The usual sampling approach we take is stratified random sampling. The reason for that is there are multiple, when we are going for a study which has open parameters, like we are not measuring only one or two key components of the study, but if you're going for a more open approach, there are multiple variables that come into play, whether it is the village level or whether it is in the same district or block. These kind of strata are considered, and then random sampling is done for each of the population. So the data collection methods we use are also largely a mix of qualitative and quantitative, where we do semi-structured and structured surveys and interviews as well as focus group discussions. Then once we have all this in place, where we have defined the scope, where we have defined what are the indicators to measure to understand the status of the community. And the third one is defining the sample and whom do we talk to, whether from the community, what is a sample, and what are the other stakeholders that we need to talk to. Once these are defined, then we go into execution. As part of execution, the key exercise that is done is stakeholder mapping. So when a stakeholder mapping is done, it is not it is done to ensure that there is a 360-degree perspective from the village. For instance, when we do a community-based study, even if we consider 600 of the 800 population, it still gives a heavy dose of inputs from a single perspective. It is also important to understand what are the local administration's priorities. If there is a village development committee, what are their priorities? What has been tried before? What has not worked before? These are some of the key components that we need to cover during the execution component. We'll also go into detail a little bit in the next slide. Then data collection is conducted, and whichever indicators that are defined earlier will be benchmarked in the specific geography. As part of solution design, we identify priority areas based on these three components. One is gap analysis of actual and benchmarked indicators. So for instance, for education, we can take the student to teacher ratio or classroom to student ratio, and the number of books that are available with the students. All of these can be taken as indicators for the quality. Similarly, for access, what is the number of population that is being addressed for a single school? These will be taken in the part of gap analysis. The second is the prioritized needs of the community. Based on the community engagement surveys and qualitative studies, prioritized needs will be identified. Similarly, ecosystem availability. When we are talking to the multiple players in government and private sector that are available, we take that component also in solution. If you could go to the next slide, please. So here we are taking in a little bit of detail on the execution and solution design. When we were saying that there is a 360-degree perspective, these are the key four components that we look at. One is the direct community, and within the community, who are the key stakeholders? It could be only women that could be concentrated on, but in a specific livelihood project we have taken, we have looked at both all youth, women, parents, as well as SHG members. Similarly, what is a local administration structure like? Then experts and practitioners within the local area, and if needed from external perspective as well. Then we also include last mile workforce. Yes, this is taken as a livelihood example. We can similarly extrapolate it to any of the thematic areas. Then when we look at the solution design, here we are giving an example of the gap mapping of indicators. A program was, a need assessment study was done in Haridwar, specifically focusing on education. These are some of the sample indicators that we have included here. The indicator measurement has been taken at a district level. to see what are the levels of student to classroom ratio, what is the dropout level, enrollment level, inclusion of girl children, etc. here. And this was compared to state values as well as national values. When we look at this, we can observe that the student to classroom ratio is actually higher in Haridwar in comparison to other areas. So the priority ranking for this was given as 0. Whereas when we consider the other parameters, Haridwar has lower values. In such cases, for instance, in girl enrollment, actually it's higher, but in service training or dropout levels and transition from primary to secondary school, these are the key areas that have been defined as lagging in comparison to state values and national values. Based on this comparison, again, a priority ranking is given, taking into account what is a percentage point difference between the localized value and the benchmark value. In the next slide, we'll talk about a specific example of need assessment study that was conducted by Sattva. So this study was commissioned by a CSR organization which has initiated a foundation in the country, and they had in place an education related service and product that they wanted to address, that they wanted to implement in a specific area in Haridwar. So within Haridwar, there were 30 to 50 schools and more colleges, intermediate colleges that had already been existed. The key component that they wanted to understand is which of the schools and colleges should they concentrate on, and to prioritize 7 to 8 schools and colleges so that they can focus their efforts specifically on them. As part of that, similarly, they also wanted to understand what is the level of community participation, what is the role of parents, are the SMCs, school management committees active or not, what are the aspiration levels, etc. So in order to get that, we followed the approach previously discussed. For the stakeholder mapping, the direct community was students and parents. As part of the administration, Gram Panchayat officers, block education officers, district educational officers, and school inspectors were also included in the study. Headmasters, school management committee, and existing NGOs working in the area in the field of education were included as experts. Last mile workers who are working directly with the students, that is the teachers, were also included. So this essentially gives a 360-degree view of the direct community that we are studying. Then in order to prioritize the benchmarking for this part, these 3 components were taken: the quality of education, access to education, and community aspiration. The indicators we have seen earlier in the previous slide, but completely related to quality of education. Access to education is more pertinent with what are the number of schools available, is it in accessible distance to the community, etc. Similarly, community aspiration is what are the aims of the students. Do they intend to go to high school, continue their education and find a job? And for the parents, what are the where do they think the students' progress will be after the completion of schooling? Whether if it is particularly a girl child, are they going to give the same level of importance for the continuation of education for girl child and boy child? These are something that have been taken. Now, when we look at it from a sustainable development goals perspective, so the SDG that we are targeting here is quality education. But within the scope of the study, we are specifically looking at primary and secondary education for all. Then 4.5, that is gender disparity, similar access to quality as well as access to education for both girl children and boy children. Then 4.6, what is the level of literacy in the community, whether it is for the parents or for the younger children. Then the last 3 components talk about what is the quality of education. What are the education facilities available? Is there a playground? Is there a bench and other infrastructure in the blackboard and other infrastructure in the school? Then how are the teachers qualified to take the undertake in undertake education in schools? And then what are the quantity of teachers available? What is the ratio of teachers to students? These were the key areas that were taken as part of sustainable development goals. So once we had conducted the study, what we had understood was The access to education was similar to, considering the location, access to education was similar in the entire location. However, there was a gender disparity in sending girl children to secondary education. The other consideration was the dropout levels. The enrollment levels and dropout levels had a disparities. As we had seen in the previous slide, the dropout levels were high. So based on the dropout levels across the 20 or 50 schools and colleges that were considered, the lowest ranking ones were chosen and recommended for the implementation program. And as part of program design, the need assessment study had informed on the need to focus on creating awareness on continuation of education, both for girl children and boy children, and creating maybe career guidance programs, etc. Hope this was informative. Then we'll go on to the one more case study we'll go through in the next slide. So this, while in the previous study that we had discussed, it was specific to a thematic area, which was only concentrated on education and only concentrated on the institutions that were available for education. This need assessment study was conducted in 3 districts and had included 4 focus areas. So a manufacturing organization particularly working in these 3 districts had focused on the surrounding villages where the thematic areas could be implemented for interventions. Then within these 3 districts, the thematic focus that was chosen was education, livelihoods, and WASH, and specifically health as well, although it's included in WASH. So as part of stakeholder mapping for each of these thematic areas, which we had discussed earlier, the community and administration experts and last mile workforce, where Anganwadi workers, Asha workers, and Rozgari work, which were discussed earlier, all of these were included as part of stakeholder mapping. Then similarly, demographic level benchmarking was done to identify priority areas. So within the 3 districts, what are the district level indicators in health, in quality education, and in livelihood? These were mapped and then compared to state level and national level indicators to identify what are the pain point areas. The key component of conducting the need assessment on ground is also that although we have secondary data to compare district level to state level and aspired benchmarks, what are the causes behind it can only be identified through in-depth surveys and focus group discussions that are conducted in the community. For instance, in priority mapping, here as described for each of the for each of the development goal, these were the indicators that were studied. The first 4 were more quantitative in nature, and second 2 were from qualitative and on-the-ground discussions. So if we can talk specifically about the health part here, what we had understood from the study was that there was an access to PHC and Asha worker in the area, and there was also Anganwadi worker. The ground level workforce was there and facilities were also there. However, the percentage of anemia among women was higher, much higher than the state level and national level indicators. So once we were able to speak to the last mile workforce, administration and experts, what we got to know was that this is mainly influenced by the nutritional habits of women in the area. So the causes were identified here. Similarly, from a WASH perspective, there was availability of safe drinking water, but the percentage of household toilets were lesser in the area. This was also identified. Then access to prenatal and antenatal healthcare is there in the area, but the level of adoption was low. So for instance, Asha workers and PHCs are available to provide the care, and the benefits of nutritious foods in Anganwadi are available, but the number of women who are accessing and adopting these schemes are relatively lower. So I'll just fast forward here a little bit. Similarly, we had interesting insights in quality education as well as livelihood, where most of the youth were working as marginal workers, and the number of women in employment was lower. And from focus group discussions, there was also the insight that the aspirational level of women to get involved in employment was also lower, specifically pinpointing what are the program components that could be addressed through these insights. Yeah. So Divya, if you could take us to the next slide once. Yeah. So this till now we have covered basically how Sattva usually does a need assessment approach. While Sattva conducts need assessment at a full scale in the regular projects, Surya will just take us through in the current context how is a rapid need assessment done. Thank you.
Yeah, thanks a lot, Jyotsna. So to quickly run you through, given the changing conditions that we cannot travel in the times of social distancing, how can we actually do a rapid needs assessment to quickly understand how the needs of the community have been changing, and help the decision makers take quick data-driven decisions and ensure that the support is being received by the community. So the first step is basically the understanding the pre-existing conditions, which we actually leverage a lot on the secondary resources, the data which is already available, understanding what kind of facilities are there, the existing health, education, and livelihood initiatives available with hospitals, schools, communities, and map the existing vulnerability. As I mentioned in the beginning, we have a data-driven platform called the India Data Insights, which is giving us data from the grassroots level from different sources. We're able to collect it, triangulate that information, and then able to understand what are the existing needs. Then that is the secondary data which we analyze, and we try and corroborate that information with the primary research. So we are trying to understand whom we can reach out to. We are leveraging on NGOs on the ground who are supporting on the relief work. We reach out to them. They try and give us information, the live information from their experiences. We're also able to reach out to the community members as well as the community leaders on phones. So we are leveraging the technology, and the telephonic conversations are helping us get the primary evidence from the ground. And based on these two, the secondary and the primary data, we are able to link the triangulate that information and come up with those findings, and we're able to offer funds and existing projects. So we are leveraging on these existing projects, we're leveraging on them, and then use these findings and then be able to make that link between. So the actionable insights are majorly on thematic areas which require utmost attention, the key interventions which can be designed to address the needs identified, the opportunities to collaborate and engage within the ecosystem, and also the measurable indicators which are required to be tracked to progress the interventions. So just to quickly put it in a summary, the rapid needs assessment leverages on secondary data, then we are leveraging on technology, the pre-existing connections, the NGOs on the ground, telephonic conversations. So we're able to triangulate all of this information to come up with what kind of interventions are required on the ground, the focus areas for us to act upon, and then be able to deliver the impact on the ground. Before we move to the next slide, we have a question. Okay, so 75% of the participants think that the benchmarking should be part of the needs assessment. Well, 19% said that they're not sure. But yeah, I mean, in our opinion, and what we do in most of the cases, we do benchmark. We try and understand, because that will help us in the decision making. So we can move to the next slide. There we can talk more about it.
We have one more question, Surya, before we move to the
Yeah,
next slide.
yeah. Okay, so we have the results of the next question as well. Well, most of the participants have mentioned that it's for tactical decision making to understand the ecosystem convergence and the program component. Also, the strategic decisions and the goals and objectives which can be taken through the needs assessment. So we'll go into those details. Like, I mean, we think that all the decisions can be taken. All the three different kinds of decisions can be taken using a needs assessment. So when we talk about strategic decisions, we're looking at a macro level, identifying the key areas in the which require some intervention, be able to prioritize. As Jyotsna mentioned, we use something called a priority mapping. So findings from that will help us identify those key focus areas where you need to intervene, or there's some support which is required. And it's also understanding the program objectives which you're going to design. Are they aligned with the community needs, and are they aligned to the ecosystem priorities? You're also defining targets based on the benchmark global, national, and local indicators. So the question we asked earlier, do we use benchmarking as one of the approaches? For sure. I mean, we should, because that will help us understand where we are and where we want to achieve. Also help us in prioritizing. So the tactical decisions are at the organization level to understand whether the organizational objectives are aligned to the program which you want to design based on the needs which you identify from the ground. The identification of the various components of the program, basically based on understanding the access, the awareness, and the knowledge of the community, and also the role of the ecosystem institutions and internal teams in achieving those objectives. So these findings will help you take those tactical decisions. Moving to the operational decisions, while you're actually designing the program and you're implementing at the program level, you're looking at how can you improve the effectiveness of the program. So this can be through identifying those nuances, those factors which influence the execution of the program on the ground, the alignment of the organizational abilities to undertake such kind of a program. Although you know that there is a particular need, but maybe your organization is not build those capabilities, or they're not focused on that before. So you might have to think that you want to invest in building some capabilities or getting some resources to be able to work on addressing that particular need. And also looking at the local feasibility of factors which influence smooth execution, such as on-ground mobilization, participation of the community, etc. So that sense also you will be able to get from the needs assessment study. So the next, we have one case study for you to think about and share your responses. So please use the chat window to share what do you think about the next case study. I request all of you to go through it. Take your time, take five to 6 minutes, and please put your thoughts on the chat window. It'll be good to know what do you think about this particular thing. To just quickly run you through what the case study is. So a needs assessment study exercise has come up with the following insights. It was found that the low to teacher-student ratio in the schools is one of the problems. There's also a lack of access to alternate education. There are no access to tuitions, private schools. So the school is the only place where children can go and study. There's low literacy levels among parents. The medium of there's medium knowledge of good agricultural practices in farming community. There's also lack of continuous irrigation due to power supply issues. So these are the various issues which were found through the needs assessment study. So one of the interventions which was developed was to initiate digital computer class based on established teaching content. So the focus was to improve the learning outcomes through the digital computer class. However, the program was unable to achieve the intended knowledge change. What could be the possible reasons? Why do you think from these findings, do you see any point which might tell you that this could be a possible reason why there is no impact? Any guesses, anyone? Well, the response to this is in the findings of the needs assessment exercise. Okay, a few responses coming in. Great. Great. I think most of you got it. Divya, can you? It's basically related to operational decision making. Power supply issues will necessitate backup solar or battery power for this implementation or the program to succeed. As you rightly said, it's the lack of the power supply issues will not allow us to or not help in making this program successful. With this, I request Pawan, my colleague, to take over and share how can we use a needs assessment findings to translate it into program interventions. Over to you, Pawan.
Thanks, Surya. So I think Surya and Josna have covered a lot about the need for need assessment and what is the process of conducting a need assessment study. I just wanted to reflect on, from the funder's perspective, what are the key considerations when we are going over the need assessment findings. One of the key things that will be important to understand is, and I mean, before I get into it, I think why this is very important is that in any need assessment study, a lot of gaps will come about. However, from from a funder perspective, resources are always limited, and it is very important for us to be able to prioritize and address what the funder can influence overall. Hence, I think one of the first points is to understand if there are any interconnectedness between the gaps that we are seeing. And many times what happens during community immersions, people are talking a lot about the symptoms, so to say, but the root cause sometimes is similar. To take take an example, we were working in Himachal Pradesh, and in one of the communities, a lot of people spoke about um, problems in terms of health issues and access to quality education issues. But when we dwelled deeper into it, we figured out that the main problem was the main road that was there in the village was not repaired and broken, and hence it was very tough for the community to find quality healthcare and educational facilities, which was leading to the educational health facilities being poor. Similarly, nutrition can be a cause for multiple causes as well. Hence, second order and third order effects is important to understand. The other point is to understand what is the outcome, what is the time frame within which the funder is expecting outcomes. Many times what happens is certain gaps that are found are systemic issues and require a long-term solution. However, if that is not in line or that is not understood by the funder, then there are possible conflicts that emerge. Hence, it's very important to understand the time frame to look at the results and accordingly choose the interventions. Third is also to understand what is the openness to look at collaborations and partnerships that we want, that the funder is open to having to be able to address any gap. There are different types of funders, and some people are very open to working with the local administration, existing players, to be able to influence and understand that they are not the whole and are a part of the whole. Whereas certain funders want to kind of look at interventions in which they are in more control, meaning external factors are very limited. So I think the below graph in a way kind of captures some of these things. Is whenever we are looking at interventions, it's important to first figure out whether it is socially desirable. Many interventions might come out as the more logical, feasible thing to intervene. However, it is important to understand from a societal, cultural norms perspective what will be the possible response to such an intervention and account for when implementing. Second is in terms of the feasibility to execute, given the externalities possible, is it a practical enough intervention to be done? I think that is the second thing to be kept. As we said, economically viable is I mean, it is self-explanatory, not just from the ability to fund perspective, but in terms of the solution itself, whether it is efficient enough to be able to deliver results. The fourth is from a sustainability perspective, any intervention, if I mean, the long-term objective is that there is a high sense of community ownership, and we are able to bring in interventions which do not rely on a continuous stream of funding year or year, and there are systems and processes built in for overall the community ownership to take place. So with that, I would like to conclude. These are few of the things that from a funding perspective also to keep in mind. This list is not exhaustive. However, probably hopefully helped you in understanding from the funding perspective what is important. Over to you, Surya.
Great, thanks a lot, Pawan. So yeah, these were the points.
Surya, sorry to interrupt. Mr. Ashutosh Sundaram, you've raised your hand. Is there anything that you would want to say? I've unmuted you, Mr. Ashutosh. Okay. Also, Vatsala, do you have anything to say because you raised your hand? Nope. Okay, I think we can proceed, Surya.
Great. Yeah. Thanks a lot, Pawan. Thanks, Jyotsna, as well, for like taking us through the different approaches to do a needs assessment, as well as thanks a lot, Pawan, for giving the funders' perspective on how we can use a needs assessment study and how we can use to translate that into a program intervention. So these were the things which we all wanted to discuss with you, and we're also sharing a few resources which you can use while you want to like do your own needs assessment study, or you just want to look at the secondary data, identify at a macro level what kind of geographical what kind of issues are existing in a few geographical areas, etc. And as I mentioned, we have a platform called India Data Insights, which can be used to understand the vulnerability profile of India on different locations in India. So please feel free to use these resources as you need. Great. So that's it from our side, and we will be answering a few of your questions. Just a second.
Surya, I can just ask the questions. That's okay.
Sure. Yeah.
Yeah. So there were a few questions. Firstly, thank you so much for asking all these very relevant questions. I think there was one question, Surya. Whoever wants to take this, isn't there conflict of interest if need assessment is done by implementation team? And this was asked by Aditya.
Okay. So I mean, in our opinion, for sure, in the sense, if you look at it from the point of view that implementation team might put their needs in rather than the community needs, for sure it's a conflict of interest. But hoping that the organization would want to actually address the needs of the community in good faith and in good trust, and obviously I think there is no conflict of interest in that way. So I mean, if you're saying that the issues on the ground might not be able to be captured by them, then obviously you can always leverage on organizations, independent organizations like third-party evaluators who can do these needs assessment or an impact evaluation, and they can deliver a report, give those findings from the ground. But if you want to do like a macro level understanding, just to identify what the community is responding to, what are the existing needs, then we understand that even the implementing partners or the NGOs can also do a quick needs assessment on the ground. Jyotsna, you want to add anything? Please go ahead.
Sure, Surya. So from which party should conduct need assessment perspective, based on whether it is a funding organization, implementation team, or a third party, the type of priorities differ a little. There is a chance that if the implementation team is conducting the need assessment, the focus could be more towards the practicality in program design. Whereas if a funding team or external team is conducted, it could be more from a top-down view. So this is one of the points I wanted to add. That's all.
Sure. So the second question is from Alex, and he's saying that I would like to assess the impact that housing development as part of SDG 11 can have on other SDGs. What will you advise to do for this assessment?
Sure. Thanks for the question, Alex. I think the important consideration is while we are talking about housing development, it's is it converting into access to minimum goods and services, so that it's enabling people to convert their income or expenses towards other economic opportunities. In such a case, I think it can definitely be mapped to lowering poverty and improving economic level, which I think are the first one and seventh SDG goals. But Surya, Pawan, please add on.
I think I agree with you, Jyotsna. Nothing to add from my end, actually.
Yeah, I think I would just say, I think if you could write to us with more details about the project, we will be able to suggest you the right methodology or the type of assessment to take.
Completely. Yeah.
All right, thank you. So the next question is also want to know what made you deprioritize some of the development indicators while prioritizing benchmark indicators? And this is from Prakhar.
Sure. Thanks, Prakhar, for the question. So while we are taking the benchmarking indicators, we have taken an exhaustive list relevant to various parameters and then compared it with the state level and national level benchmarks. So for instance, the advised and aspirational benchmark for student teacher ratio is approximately 32, and a particular intervention area or the target area is able to allocate 28, which is a better number than 32, then that particular area will be deprioritized. So it definitely shows that there is no need for additional teachers to be available in the school. However, if there is a quality related issue, for instance, there is no infrastructure within the school in comparison to each school should have at least a playground, benches, blackboard, etc. Those will be considered for as an independent indicator. In such a case, the target area will rank lower in infrastructure rate in comparison to state and national level, and that will be identified as a priority area. Hope, I mean, it's a very specific example, but hope that helps in clarifying.
Thank you, Jyotsna. The next question is, I'm curious to know if community attitudes are also included in the need assessment framework that you shared. Is it inbuilt into the data collection tools or how is that done? It is important to understand the socio-cultural matrix of an area and people's attitudes towards issues prior to any response to bring change that can be designed. How is that ensured?
Jyotsna, you want to take that?
Sure, Surya. Thank you, Bijita, for that question. So, considering the attitudes of the community, the socio-economic dynamics, the political hierarchy, what is the relationship, matrix within the community is definitely a very key part of understanding the community before entering into a project stage. So, that is definitely included in the framework. Because it's not not in front of us, I'm just going to pinpoint the specific ones. While we are talking about awareness regarding problems or aspirational values, the reasons behind why there is no aspiration or why there is no access, what are the key problem areas that some people consider and do not consider, those are definitely included as part of the framework. And then it goes into the detail of, is it due to the general hierarchy that is followed in the village level, or is it due to individual opinions and perceptions? These are included in the framework and then translated into data collection tools, where survey might not bring the best amount of information, but the focus group discussions and in-depth interviews are the key sources for gathering information on these perspectives. Thank you.
And also just a point to add there to Jyotsna, as Jyotsna has discussed about the stakeholder mapping, and we speak to different stakeholders within the community. That also gives us a 360-degree point of view, because we don't assume that it's a homogeneous community where everyone thinks in the same way. It could be the attitude of a particular set of group of people belonging to that community, but others might have different attitudes as well as different opinions. So this discussions with different stakeholders will help us identify what are the relationships between the people, the system, the incentives which are there in that community, so that we'll be able to identify actually what are the interventions which are required based on that.
Sure, thank you. So the next question is, do you see stakeholder mapping as a subset process that is a part of needs assessment or as a separate process?
I can take that. We see it as a part of the needs assessment. As I just mentioned, we would like to speak to as many different stakeholders as possible to get that overall picture of the needs of the community, because there could be different needs. There could be perceived needs where certain set of community members believe that they need it. They might not need it actually. It's just that they feel that they might need it. There could also be forced needs where certain pressure group or certain external factors are playing a role in making people think that it is a need. It might not be inherent need which people have come about, but yeah. So these various things, to be able to capture, we would have to do that stakeholder mapping and have these conversations, have the qualitative and the quantitative discussions with all the different stakeholders.
All
Just
right.
to
Yeah, sorry, Jyotsna.
just to add on to that, in need assessment, definitely stakeholder mapping is a key part, but stakeholder mapping is also done once a program design and implementation process is initiated during the starting stages of program as well. Yeah, sorry, Tanya, go ahead.
Yeah. Thank you, both of you. The next question is, how selection of indicators can be done when need assessment focuses on training needs? This is something more specific, but yeah, whoever wants to take this question.
Jyotsna, you want to take it?
Sure, Surya. So while the question says training needs, I'm assuming it's related to a specific sector, and or if Karthik, you could provide a more context, whether it is agriculture knowledge related training or skill development kind of training. Yeah. So
please let us know in the chat window.
Maybe we can just come back to the question once if we have any more detail. Otherwise, we can answer it as is.
He's saying capacity building, but again, like if we can also mention the sector, Karthik. So moving to the next question, we can come back to this. We want to do, so this is from Pravina, we want to do post-COVID impact study of entrepreneurs in Maharashtra. Can you guide regarding secondary data sources before designing primary research? Again, little specific.
So, I mean, I would suggest, we can for sure support, would request you to drop an email with more information, and we would love to help you out with the sources. We have shared like this page which has all the sources that we'll share it with you. But also, if you have any more specific requests, please drop in an email, and we'll be happy to help you.
Right. So Karthik has come back with the sector also. Now he says local government capacity building on environment sector.
Sure. Thank you, Karthik, for the clarification. I think from a training needs perspective, if it is specific to environment and government, stakeholders, the first thing is to understand what is the current level of awareness regarding the technical aspects, and that would include the quality of material available, and if there are any refresher kind of training courses undertaken for the departments annually, or if there is any new material that is generated to update the knowledge of the relevant stakeholders. Those would be 2-3 key indicators. But the other aspects would also be very specific to environment, the technical aspects of environment. That would go into the quality of the curriculum or the type of training being conducted. If there is satisfactory response, low participation, those could be some of the indicators. Yeah. Hope that is helpful. Tanya, I think we can go.
Yeah, sure. So the next question is from Parul. In the framework of need assessment, where does understanding existing solutions fit? Surya, could you follow that? Like, do you want to take this?
Sorry, I missed the question. Could you repeat, Tanya?
Yeah, sure. In the framework of need assessment, where does understanding existing solutions fit?
Okay. So can you go back, Divya, if you can go back to that slide where we had the 6 different parts of the framework. So the existing solutions will be part of, I would say, accessibility, the adoption, as well as the accreditation. So these will help us understand what kind of existing schemes are running, or what kind of existing interventions or programs which are available, the infrastructure which is available. So those will also be part of our understanding whether the people are able to access these. Even though they're existing, they might not be accessing it, they might not be adopting those things, or they might feel that the quality should be better, or it's not meeting their existing needs. So that will come into the overall framework in these 3 places, as a part of these 3 lenses, I'm saying.
So the next question is from Deepthi Singhal. She's saying, are there any suggestions or solutions for virtual needs assessment studies due to current limitations?
As we discussed in the rapid needs assessment, we are trying to, as I mentioned, leverage on the secondary data sources which are available, identify the major gaps, then use technology, or do telephonic conversations to collect the primary data from the ground and triangulate this information so that you can virtually be able to pull it off, like understand the needs of the community and then design the programs around that. That's the point of the rapid assessment slide, actually.
I hope that answers your question. So the next question is, how do you integrate technology across multiple sectors while conducting needs assessment?
So integration of technology, I would say, it's majorly we can use it for data collection, data analysis, and data visualization. So the data collection can be done through various apps which are available. We have shared one link of an open source application that can be used for free, which will help us in collecting the data. Even there are, I think, set of questions already pre-existing, which were used in other studies earlier. So that particular platform can be used to collect the data. For the data analysis, you have like the quantitative data analysis tools such as R, or Tableau or Stata. There are different kinds of data analysis tools which can be used to analyze the data. If the data set is not huge, you can actually use Excel as well. And when you're visualizing, you have different, again, tools such as Tableau, where you can see the visualization of the data analysis part. So yeah, these are the major 3 areas I would say we can use technology. But yeah, Jyotsna, if you want to add, please do.
Surya, I think definitely covered the technology utilization. Yeah, nothing to add from my end.
Thank you so much, Surya and Jyotsna. So there are a bunch of other questions, but given that we've already crossed the timeline, we may be able to answer those offline. There are a bunch of also like people asking regarding the resources and the deck itself. So Surya, Jyotsna, do you want to answer that? we can
Yeah, so
probably
I think we will reach out to the questions, like the people who have asked the questions, we'll reach out to you individually. If you have more questions, please write to us at impact@sattva.co.in. We would love to help you in any way possible. Given talking about the resources, we have recorded this session, so we will also put it on all the social media platforms, and you can access it from there, or we'll also send a link of the recording to you, and we'll also share the slide, or I mean, we'll add more resources, and we can share that with you also, so that you can use it. Great. Thank you all so much for taking out time and joining us today. Hope you have found it useful. Hope you felt that the session was fruitful. Looking forward to staying in touch with you all. Thank you again.
Thank you, everyone.
Thank you.